Hey there, it's Jocelyn from the Vagina Doc Physical Therapy and Wellness. And one question that I often get is, what is pelvic floor physical therapy and what is going to happen on my first visit? Well, pelvic floor physical therapy is a specialized part of the physical therapy profession where we help women with issues such as leaking during coughing, laughing, or sneezing, painful intercourse, bowel dysfunction, including but not limited to fecal incontinence, constipation, painful bowel movements. We also treat issues related to back pain, pain around the pelvis or hips, and issues related to the abdominal wall such as diastasis recti, post-surgical rehab after having a cesarean section delivery or a hysterectomy. I could go on and on. Even though it's specialized, there's a lot to it. So what you can expect during your first visit is I will take a thorough history. So what brought you to here today? I ask you a lot of questions that you may not think to report during your subjective or put in your paperwork before you come in. And those are questions related to bathroom habits as a child, history, sexual history related to your periods, if you are on birth control, if you know anything about your hormone function, diet, exercise. That usually takes about 15 to 30 minutes, depending on how long it varies. And then from there, I walk you through what I plan to do next. So if let's say you're coming in because you're leaking when you jump, then I talk about pelvic floor anatomy and how I examine that anatomy. So I walk you through step by step of my exam, and then I either do a movement exam first, meaning looking at the movements that are important to you where you are having difficulty, or maybe you're not having difficulty, but I find that those movements are important for me to understand why you're having the problems that you're having. Then I either take a look at your abdominal wall if you're a new mom or an old mom, had kids previously, or I still look at the abdominal wall either way. And then I move on to taking a look at the structure of your pelvis, this portion here, and I make sure I take a look to see if what your starting alignment is. And sometimes I will correct it right then and there, especially if you're having pain. Sometimes I just put that on, write that down to come back to later, and then I move on to a pelvic floor exam. So what a pelvic floor exam is similar to what you would experience at a gynecologist's office, except I am not looking for diseases such as anything related to the cellular diseases. I don't use a speculum. All I do is I put a pair of gloves on, sometimes two, and I examine the muscles and the connective tissue of your pelvic floor. So how I do that is I insert my index finger either through the vagina or through the anus, and from there I check power, I check endurance, I check strength, and how well your fast twitch muscles work in your pelvic floor. I also check for pain, and then sometimes, let's say if you're coming in for prolapse and your symptoms happen after you're deadlifting or squatting, then I check those muscles and I check how everything's sitting in the standing position, because that's where we function in life. From then, we establish a plan of action. So let's say we need to work on strength. Then I put you on a program based on my findings to get you stronger for what you need to do. Let's say we need to deal with pain first, then we're going to do that either through soft tissue work, myofascial release, dry needling, cupping. Those are just a few examples. Let's say you're coming in for pelvic pain, then sometimes we're talking about nutrition, we're talking about different habits that you can change to help reduce the intensity and frequency of your pain. So that, then as we wrap up, we revisit what you're coming in for and why you're coming in and what your goals are, and I create a roadmap with you on how we're going to get there, so that and then based on your goals, I tell you how long it should take and how many visits I recommend coming back versus how much on your own I want you to work on. It's perfectly okay to be nervous again. But I promise that I hold a safe space, and it's not as weird as it seems. It's totally medical, and it is such a learning experience and super helpful to understand where you're coming from. And I'm saying for you to understand how strong you are in an area you may not even known existed. So if you have any questions on anything that I did not cover or anything I did cover, feel free to send me an email. If you would like to schedule a discovery chat or would like to meet me for coffee to chat, send me an email. If you would like to schedule a visit, I do home visits as well as I work out of a gym in the Valley. You can click the services tabs and then click schedule an appointment, and it'll bring you to my appointment slots. I can't wait to hear from you, and I will see you soon.